Okay, hi everybody. It's Dr. Joel. I'm sharing this video, I want to say reluctantly, but it's by popular demand that I've been asked to do this. And I say reluctantly because I feel like it's such a polarizing topic. And some people get actually very emotional and angry about the topic. And the topic is masks, but I'm sharing it because I would like to share with you stuff, information and research that you do not hear on the mainstream media, which to me is very sad. The mainstream media has one narrative that they follow, and any one or any research that goes against it or that opposes that point of view is just actually pulled off of the internet, not allowed to talk about, pulled off social media, um, and is almost taboo to discuss. And so I would like to share the topic of mass. Before I do so, I just would like to start by showing you where we are today in terms of cases as it relates to, like, here's an update of COVID-19 and the pandemic. So we can see here from March till November that cases have gone up, down, and then they're surging again, as everyone is well aware of. But if you look closely at this graph, you'll actually see the bottom red marks here are the deaths associated with the pandemic. And so the cases are surging now. However, the death is decreasing compared to April and May of this year. And there's a couple of reasons for that. And again, I don't think you hear this in the on the news. Unfortunately, you just hear about the cases and how the cases are terrible. Now, it's important to note, one, that the deaths lag cases by 2 weeks. However, we can see from September, October, and November that the cases are surging, but the deaths are not. Here are the reasons why they are not. Number one, we're better at treating people who have COVID-19, which is fantastic. And so we're no longer intubating them and putting on ventilators by and large. We've recognized that that was a mistake and was not helping the people, unfortunately. But we've learned from that, so we're taking better care of people. Number two, the other reason why is because it's natural during the course of a pandemic for the virus to get less virulent. So that means that the virus is not as aggressive on humans as it is at the beginning of pandemics, and that's been shown over and over the course of all pandemics in the history. So this is what we're seeing now as well. So even though the cases are far higher because we're testing way more as well than they were even at the beginning in March, maybe even 3 times higher, the death rate continues to decrease. That should be good news for most people, and that should give you a little bit of sense of relief, which is good. So now let's get back to what we were talking about, which is actually the wearing of masks and if they're necessary or not. I just want you to understand that not all research is created equal. There's a hierarchy of research. And most people aren't aware of it, but like systematic reviews and meta-analysis are first, and then you have randomized controlled trials, and it works all the way down to the expert opinion, which is like the bottom of the barrel. It's just my expert opinion, so you should just follow it. Okay, and so we give more importance to systematic reviews and randomized controlled trials because that's considered what's called the gold standard of research. By and large, I have to say that the majority of the research that's been done in the years leading up to the pandemic has shown that the wearing of masks for respiratory virus infections does not work. It's that simple. The RCTs that are out there, they clearly state that masks do not work. The World Health Organization and the Center for Disease Control have always said in the past that you should not wear masks for respiratory viruses because the research shows it doesn't work. For some reason, and I have ideas, but I don't know exactly why, because the research does not support it, even though there is research, which we'll talk about, that can show in the lab that there is some level of prevention. The real prevention does not exist from masks, and the best science that's out there still confirms that masks are inefficient at protecting us from respiratory viruses. Before you get mad, we'll go over, here's something that we have at the office. In conclusion, there's 45 or 48 studies that we list in this document from Dr. Sherry Tenpenny, and I've read them, each one of them, and by and large, they clearly state that the RCTs, randomized controlled trials, show that masks do not work. They also show that it could lead to increase in infection, and that's very hard for people to believe because the news doesn't tell you that, but I'm telling you that because the research shows that. Also, if you go to greenmedinfo.com, oh, sorry, you didn't see this. Let me add that. So that now you can see the conclusion regarding masks. They do not work. This is Dr. Sherry Tenpenny's work. Next one I want to show you is from greenmedinfo.com. And this is peer-reviewed medical journals from the National Library of Medicine, or PubMed. And there's 35 abstracts here that show the ineffectiveness of face mask wearing. Again, other research that shows that it doesn't work. And again, we have meta-analyses, we have RCTs, and they show for respiratory viruses it doesn't work. And again, on November 18th, we had the largest RCT ever done specifically to SARS-CoV-2 infection. And what they did in this research, which was interesting, is they did 6,024 adults. They gave half of them masks to wear, and the other half they didn't give masks. They instructed the ones who were masked to also socially distance, and the ones who weren't wearing masks also to socially distance. And what they found was that there was virtually no difference. So the slight difference was 0.3%. So ultimately, out of those 6,000 people, the ones who were wearing masks, 1.8% were infected. The ones who were not wearing masks, 2.1% were infected, meaning the difference is 0.3%, which is within the margin of error, which is literally negligible, which means that out of 100, 2 people got infected with the mask, and out of 100, 2 people got infected without wearing the mask. Again, showing what all of the research, I don't want to say all of, but what the important research and the vast majority of the research has shown for decades leading up to this pandemic. And a lot of people don't want to hear that, but that is the truth. And so if you knew that there was 0 chance of rain, you would not bring an umbrella. And if you knew that there was a 0.3% chance of rain, you also would not bring an umbrella, because that means there's a 99.7% chance that it will not rain. So just to put that into perspective. So that is the conclusion of that most important study. Of course, there are naysayers, but this is a randomized controlled trial. And it was a study that was well done, and it was published in the Annals of Internal Medicine. Interestingly enough, the New England Journal of Medicine, the Journal of American Medical Association, and the Lancet all refused to publish this study, not on merit of the research, but because it went against the mainstream media narrative, just FYI. So now that's the research. I want to get a little bit more practical, and I'd like to show you a video of somebody who is vaping with a mask on. And I want to show you what this looks like, and we'll discuss it in a second. So here it is. We're going to watch this guy vape. Here we go. Let's get this playing. So through the mask, he's inhaling the vape through the mask. Okay. And now watch what happens when he exhales. I mean, it's coming right out of the mask. Now, I want to pause that right there, okay? And I'm pausing it there to let you know that the particles that are found in the vapor, in the smoke, that smoke that's coming out of them, those particles are 50 microns in size approximately, whereas the size of the coronavirus is 50 to 125 nanometers, 1,000 times smaller. The virus is 1,000 times smaller than the smoke that's coming out of this person's mask. So just to put that into perspective for you, that would be the difference between having a Hot Wheels car, for example, that's 3 inches, versus, and 1,000 times bigger than that is the length of a 747 airplane. So just to put that into perspective, so if a 747 can get through a section, then definitely a Hot Wheels car can get through that section. And that's the difference in the particulate size that we're talking about of smoke versus the 50 to 125 nanometer size of the coronavirus. And so I feel like that helps people kind of get an idea, because they feel like if they have something there that it can't get through because bigger particles can't get through. However, they can. Just because you can't see viruses, you need, it's like almost on the quantum size when we're talking about nanometers. Nanometers are 1 billionth the size of something that you can see. So they're extremely, extremely small. And so I feel like that's a good indication or a good visual for that. Okay, let's move on here. And now what I'd like to show you is just kind of practical stuff. Here's what's practical to me, is saying, if we look at what happened in England, in the UK, we see on the left the COVID cases, and then you see the arrow where the masks were required. And by and large, there was huge adoption of the masks. So you can see that if the masks were to work, why would the cases be skyrocketing? That's a question that is a fair question. And again, in the lab, you could look at research that shows that maybe there's some slight protection, but in real life, all of the research shows that there isn't. It's interesting because I went to the CDC and read the research, the 8 links that they had on the CDC website for research on masks. And I find some of it was decent, but a lot of it was not good research, in the sense that they were measuring particles that were 300 nanometers, which is anywhere between 2.5 to 6 times as big as the coronavirus. Well, 2.5 to 6 times bigger is a massive difference when you're talking about that particulate size. So that was the UK, and I'm going to speed through a couple of them just so you can see. This is Spain. Again, Spain coronavirus cases, and then look at where they require the mask early on, and then all of a sudden they continue to shoot up, the cases do, because you can't control the viruses with a mask. It's very clear. Let's move on. If you don't believe that one, let's look at Italy. They require the mask at the end, and then all of a sudden, after the mask, it increases significantly. Let's go to the next one. Here's France. And clearly you can see it doesn't work there either. Let's go to the next one. Here's Germany, required mask early on, and now they're shooting up again, even though masks are mandated there as well. Same thing happens in Austria. And now here's the difference between masks and no mask required. No masks are the lines in red, and masks are the lines in black. And you can see actually that it seems like the areas that do not require masks have less cases than the areas that do require masks. Goes totally against what you're told, but I do believe that there's some element of brainwashing that's going on, because the research shows the opposite. Here's in Montana. In Montana, you can see in the center there's a line, a very fine line, but it says that masks are required in indoor spaces and outdoor gatherings, and post the requirement, then the cases still rise. Here is Kansas City, Missouri. Kansas City, Missouri, the mask mandate was 628 or 629. And post that, it continues to increase. And again, here's the difference between the Czech Republic and Sweden. Sweden's showing a slight spike in cases now, and they still don't require masks. But if you look at the graph on the right, Czech Republic required masks 4 different times, where they increased the mandate for wearing them basically at the end, wearing them at all times. And their cases are still spiking greater than where there's no mask mandate. So by and large, I feel like there's overwhelming evidence. There's overwhelming evidence showing that masks are ineffective, and there's evidence showing that they can actually cause harm. And so for whatever reason, that's not what we're hearing. People are saying, I believe that the mask is a placeholder for the vaccine and just wanting to get everybody vaccinated. But even Dr. Fauci last week said that even when the vaccine comes out and everyone gets vaccinated, they're still going to recommend wearing masks and social distancing even post-vaccination. So that to me right there actually states that none of those are effective. I would definitely caution you on the vaccine. I think you need to do a lot of research. We probably will have to do another video to follow up on the vaccine. But there you go. Those are my thoughts based on research. If you have questions, feel free to ask. I'm sure everyone's going to bring opposing research, and trust me, I've read the opposing research as well. But by and large, it's overwhelming that the quality research shows that the face masks don't work to protect respiratory viruses, which was the stance of the World Health Organization and the CDC prior to the pandemic. And the research continues to show that as we've seen. So thanks. Let me know if you have any questions. Appreciate it.